And goodbye, Dr. Montana, and we'll see you again. Yes, I've had the pleasure to sit in several of his sessions, his teaching sessions and his sharing sessions, and I appreciate the vision he has. And as we move forward with the work that we're doing here in Saskatchewan, for myself, I'm from Treaty 4, and I'm from Muskowgan. I'm Cree. I'm a grandmother. I have an Indigenous name, which is, wow, I forgot. It's been a long, long day. But it's kind-hearted warrior woman. Medewe no Kechitasqueo. And so for me, that means a lot in terms of what we're talking about here. And I'm thankful that they asked me to come and speak a bit about the work that I've been doing as an Indigenous woman, as someone who's concerned about what is happening in the Aboriginal community, in the Indigenous community. And so I switched back between Aboriginal and Indigenous. Aboriginal is a government term that we feel the government likes to call First Nations, Métis, Inuit, and people of Aboriginal ancestry. At All Nations Hope, we've adopted the term Indigenous, just a little bit more inclusive of what we're wanting to move forward with. And as we move forward, it's important to us that we are using terminology that is going to bring life to the community. So I was asked, and very thankful to come and talk not about All Nations Hope, but about the Saskatchewan Indigenous strategy on HIV/AIDS, which was released on December 1st of 2014, which is held at the All Nations Hope Network. In the beginning, 3 years ago, people began talking about what was happening in the Indigenous community here in Saskatchewan, about the rate of HIV, about a lot of the issues that were of concern, some of the health and social issues that some of the speakers have brought forward, but also some of what the chief has shared with us. And it was important to us as Indigenous people that we step forward and begin to gather and to talk about it and to seek some solutions from an Indigenous perspective. And so this strategy is on the All Nations Hope website, so it's there for people to have a look at and to download. We are just in the process of hiring a coordinator for this strategy for the next 3 years. And so as we move forward, we want to work more in partnership with what already exists here in this province. And it's, we've done a good strategy here in this province, in the past 4 years of the provincial government. But as Indigenous people, we want to be included in the work that's been happening. So it's a very, the services and programs that we see in our local, in our cities, in our health regions, and some of the existing and long-term funded groups in this province that have been addressing HIV/AIDS for many, many years, like AIDS Saskatoon and AIDS Program South Saskatchewan, the Avenue, the Persons Living with AIDS Network, and All Nations Hope. Those are the agencies I'm very, very familiar with because over the years we've worked together. We've always gathered and talked about the issues around HIV and AIDS. And I can remember, as a university student, going to the local AIDS Regina, which was on 14th Avenue over here, to gather information to do a report on AIDS for one of my health studies classes. And at that point, and that was probably back in 1988, it was just a little building, and there was just a 2-room place, and it was run by the gay population, and they welcomed me, and they talked to me about the Aboriginal people and the impact that HIV could have on the population, because they, as the frontline workers, we know where the virus is going. We know where, the impact it's going to have on the communities, because we're at the front lines all the time, dealing with some of the issues that are hard to talk about. And in the Indigenous communities, what drives HIV is addiction. And so we see a lot of stigma, ignorance, and discrimination that's associated with this disease, but we also see that with being Indigenous. But we also see that with being Two-Spirit. We also see that with other poverty, homelessness, all those health and social conditions, violence. So we talk about that, and those are things that we want to dig deep for, right? So it's not just as Indigenous people, we're looking for solutions, right? We're looking for what will bring life to our communities. And for us, it's not just a pill or a treatment that's going to bring life to our communities. It's so much more than that. It's working in a holistic aspect in terms of identifying the teachings of the medicine wheel. And an elder of mine who I respect highly talks about the medicine wheel and says that medicine wheel is for all nations. It's not just for First Nations, Métis, or Inuit people, but it's for all nations. And if you look at the logo of Sicha, which is up here, all the different colors, there's the white, the yellow, the red, and the black. And those represent the nations of the world, right? And we all have those similar teachings. But as we move forward, we've lost those somewhere along the way. And as for Indigenous people here in Saskatchewan, we've lost much. We've lost our language, we've lost our traditions, our culture, our teachings, our ceremonies. And those are the things that this strategy talks about. We want to work hand in hand now with what exists here in this province to bring forward life to the people. And so that's important for us as we move forward, that we're working closely together. And I can't emphasize more than what I did today, early in our meetings, that the opportunity is there now and today to bring forward what needs to happen, to work closely together as Indigenous people and other nations to make sure that we're being the best of both worlds. So for us, the meeting today I felt was a bit clinical, but we had a lot of doctors and a lot of champions in the room from different areas of the province and in Canada that came and wanted to look for solutions on how we can address some of what is happening here in Saskatchewan. You heard the statistics that were shared here today about what is happening here, so I'm not going to go into detail with that. But for us, it's so much more than just a pill. It's so much more than what we need to look at to address in our communities, right? When I listen to some of the people who speak that live with HIV, and they say that HIV isn't the problem in their life, it's much deeper rooted issues that have to be addressed. So yes, treatment is great, but we still need to look at some of those deeper rooted issues that have caused some of our community members to be living with HIV, right? And to help them heal and to help them move forward. And if that's involving some of our ways as Indigenous people, then we need to share those with the community that's providing that treatment, right? And they need to understand us as Indigenous people. Why is it that we're always the ones walking through the doors of these different institutions and agencies and systems at the greatest numbers? Why do we have the greatest numbers in many different areas? Well, we need to understand that ourselves as Indigenous people first and foremost. And then we need you to understand that too, that why it is our community members that are coming through those doors and asking for support if they do make it to those doors. And that's the other piece of what we're looking at here in Saskatchewan, is the outreach that needs to happen, the work that needs to take place so that we are getting to the doors of those different places to get care, treatment, and support. Why is it that we're not getting to those doors? And those are some of the questions that we want to answer, and we want to move forward in terms of addressing that with agencies that are doing that work. Also the research that's been happening in Saskatchewan and in Canada. Some of our national partners are here today that are doing research in this province in helping us to move forward. And I believe that research has that ability to help us to move forward in the work that we're doing, to bring life to the communities. We're involved in a research project right now, Dr. Carrie Barassa from the First Nations University of Canada, and she had to leave. But it's a Digging Deep research project, and we've got some of our navigators here and some of our student researchers here who are helping us with that 3-year project here in the city of Regina. And it's about reaching out to the Indigenous women who are at risk and women who are living with HIV, to help them understand, to help us understand, help you understand some of the professionals, some of the institution system, other agencies that are dealing with, that are providing a service to Indigenous people. Why is it that the women aren't making it to those doors, for one? And the other piece on that is how can we make it better so that when they do walk to those doors that they're providing a service, or the service that's being provided is culturally competent, that you understand us as Indigenous people. You don't look at us just as a statistic, but we're as a human being, and that this is why the way we are. We want you to know our past, where we came from, and how we got to where we are today. But we also want you to be part of our vision for the wellness and the health of Indigenous people. As a grandmother, I speak loudly and boldly because I don't want my children or my grandchildren to experience what my ancestors have experienced in this land called Canada. And so, you know, it's important. I think that the passion, the commitment, we had a group of committed people, people that work in this province for many, many years. They've been doing this work, and it's time to work together now to address some of those ways to, and I like what the Chief said again, to work with us, work with Indigenous people to bring forward those solutions. And we have our own science, we have our own ways of healing, but we can work together with some of the treatments for HIV and some of the treatments for hepatitis C. And you know, there's so much work that can get done, but in a good way together, and working with some of what we want to reestablish and restore in our communities. You know, we want to restore our nations to what we once were in this land. You know, our ancestors were once here, and they're still here, and you know, we're continuing on that work as Indigenous people. And you know, the work that needs to happen has to be done together. It can't be done separately in silos. And you know, I have worked in this area with All Nations Hope for 15 years, and as we move forward, I see more movement, and I see more solutions coming forward. And you know, in the past 10 years at All Nations Hope, we've picked up the fact that we have to do ceremony first and foremost. And I was so thankful today that Stryker Cher brought one of the elders that we'd like to bring with us too when we do work in the area to come in and pray for us and to ask for good things. And her prayer was very, very inspiring. It was just touched my heart and touched the heart of the people that were there. And she's here today. Lillian Pipot is sitting right there. She's been a longtime supporter of the work here in Saskatchewan. And you know, like all of us that are involved, we all have a reason why we're here. And you know, we all have a passion for the people, right? And for the betterment of the people. Otherwise, what are you doing here if you don't understand the humanity of the work that we're doing and the compassion that we have for the people who are not only living with HIV, but those that are at risk. We have a whole population that in our urban settings that are homeless, that live in poverty, that don't have the basic needs that we have. And I'm not even going to talk about what goes on in some of our First Nation communities. You know, that is another story, right? And so, you know, there's so much information that needs to be shared with Saskatchewan, and the work that we can do in partnership to collaborate together to help us move forward, but also to respect our ways as Indigenous people, to understand where it is we're coming from when we talk about our ceremonies, our language, our traditions, and you know, those are important things to us, our relationship with the land. You know, important things to understand when you want to work with us. Ask us about it, sit down with us and meet with us and ask us how we can work together. That's what we need to do, and to be open and respectful with one another. I respect the medications that are coming forward. Today we had some information around some of the drugs, and over the last week, I know I've been involved in several meetings where we're talking about new treatments for hepatitis C. And you know, why is it still in Indigenous population here that we still are seeing people die of hepatitis C when this is a disease that is curable, right? And why is it that we still see HIV, you know, people progressing on to AIDS and dying when this is supposed to be a chronic illness? And so those are things that we think about. Those are the things that drive me, I know, and drive the network in addressing some of what we're seeing. And to bring life to the community at all costs, right? Because it's for the future generations of the people, right? Not only my generation, but your generation too. You know, the future generations. And when we talk about our ancestors being present here in our meetings and in the work that we do, that every gathering, every meeting, every conference, everything that we do is ceremony. And today was all about ceremony. And when I said my ancestors were here and they pushed me forward to do the work that I'm doing, well, your ancestors are here too. They're doing the same thing with you, acknowledging that it's time now to work together and to work in unity, and to understand that, you know, it's not going to get done on its own. That we have to once more pick up that understanding of working together and working as one in unity, so we can help one another. All the nations that you see in the medicine wheel, all those nations each have a special gift to offer society or offer community, and we need to work together now to establish those those types of, that type of work that is so important and so close to my heart and dear to my heart as we move forward, because it's all about humanity, right? It's about the human being first and foremost, and to treat each other with respect and to move forward in a good way. And I'm thankful again for many, many things today, to be able to speak and to be able to sit with many of you over the years and continue to sit with you and to look for solutions for what we're talking about today. Very solution orientated. The days of complaining and blaming and shaming are over. It's time to move forward, and let's look for solutions together, and let's make a difference for the generations to come, because that's what life is all about, isn't it? Isn't that what it's all about? And another teaching that I love is that the greatest medicine we have is love, and love is free. And the doctors, you write those prescriptions for love for the people, and we'll get them and we'll share them, because that's really what it's all about. The working together, and the greatest medicine of all is love, and I truly believe that. And I just wanted to thank again Cher for having me come and share a bit about some of the work that we've been doing, and some of our values and our beliefs and our understandings as we move forward. I'm learning too. We're all learning, and I think it's a great opportunity to gather and to look for solutions. So thank you very much.